Just 1 second.
All right. We are recording. We're on Facebook Live, and Tara has control.
Okay. The hour of 7 o'clock having arrived on this 1st of December, 2020, I will now call to order the City of Racine Common Council. The first order of business is the Pledge of Allegiance to the flag. If everyone could please stand and face the east and join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you, everyone, very much for that. President Tate, are there any excused absences for this evening?
Alder Jones is excused.
All right, thank you. Just as a technical thing, we have noticed a little bit tonight, some people's microphones seem to toggle on and off, so be patient with it. And there also seems to be a couple second delay after you unmute yourself to be able to be heard. So just be aware of that as we're calling roll call or if you want to speak. So the first thing that we're going to do tonight that I think is very important is just take a few minutes to give some remembrances of former interim mayor and former council president Dennis Weiser, who passed away unexpectedly just before Thanksgiving this past week. I just wanted to give alders the opportunity just to say a few words about Alder Weiser. I know, I mean, he is certainly somebody I first knew as an educator and, you know, a union leader, a school board member, an alder, an interim mayor. And that certainly speaks to positions that he held and the decades of public service that our community got to enjoy from that. I remember him being ever the educator as I was trying to figure out this role as mayor. And his sense of humor that was always there. I mean, even in tough times, he would always have some quip to break the tension and, you know, make us not take ourselves so seriously in those moments. And, you know, at the same time, obviously took public service very, very seriously and really dedicated most of his adult life serving the community one way or another, either by educating our children or serving on elected boards, and even filling in a time of need in between the previous administration and my own by serving ably as the interim mayor. And I don't think anybody had any questions or doubts that Dennis Weiser was the right guy to fill that role. He died unexpectedly and too soon, and he will be really sorely missed. Our hearts certainly go out to Mary and all of his friends and family. And, you know, there are no words that we can offer here that will assuage the loss that he's left in our hearts and in our community. But I did want to give alders the opportunity, if they wanted, to say a few words in memory of Mr. Weiser. So if there's anybody who'd like to do that, please feel free. Alder Tate, President Tate.
This is hard. You know, Dennis Weiser, when I first even expressed interest in wanting to run for public office, he was one of the first people to encourage me to do so and saw something in me that, you know, perhaps I didn't necessarily see in myself as far as leadership. And, you know, he served as a mentor for me on Common Council, as a confidant. And, you know, as you said, Mayor Mason, just in my view, the epitome of an elder statesman. You know, served in leadership capacities in virtually every local government body, with the exception of the county, and was a voice of reason, voice of vision. You know, he was the one who sounded the alarm on net new construction, when others didn't necessarily recognize that. And every time I think about him not being here, I think about not hearing him make the funny, witty comment, not hearing him set up the goofy joke and the weird chuckle that he had. So certainly, hearing that news that he was gone shocked me for one, and then just saddened me to really no end, because he was so friendly and so well liked throughout the city, throughout the community, and just seen as a person who, maybe you didn't agree all the time, maybe you didn't like the decisions that he made, but you didn't think there was anything nefarious behind that. You didn't think he had some ulterior motivation for making that decision. He made an assessment and he made the call that he thought was best, and he made a rational explanation as to why. And it is a tragic loss, not only for the community, but especially for Mary, his partner, and his loved ones, and for his friends. And it's even more challenging because it's happening at this time, when everyone and so many people are experiencing losses, whether by pandemic or some other means, and to not be able to kind of mourn together at this time is so hard. And I just, hope that everybody kind of keeps, his family and loved ones in their thoughts and prayers. And that we all just continue to kind of, even though we're socially distancing, if you don't live in the same household, for those who are in the same household, hold each other a little closer, maybe during this time, because we don't know, what tomorrow is going to bring and how it's going to affect ourselves or our community. And tell the people that you haven't seen for a while that you love them, because I had spoken to my dad just a couple weeks ago and said I need to give him a call, and I didn't get to do it before he was gone. So make sure you're reaching out to the people you care about. Thank you.
Thank you, President Tate. Alder Levy?
Thank you, Mr. President. I apologize for not getting unmuted. I want to acknowledge Dennis Weiser's longtime leadership in our community. As a Scene Unified teacher and a fellow union member of REA, I want to acknowledge that Dennis Weiser provided extensive leadership for our teachers union, both as president and then as our executive director. He then moved on to leadership, as we know, and the school board, and then also on our Common Council. And so I want to acknowledge his commitment to our community, and I valued his leadership in all of those areas that he reached out to in our community. And so I want to send prayers and my condolences to his family and friends during this difficult time.
Thank you so much, Alder Levy. Alder Land?
Yes, I was shocked and saddened when I heard about Dennis's passing, and I consider myself very lucky and blessed to have been able to sit next to him when I first came on the council. I used to tell him, a better mentor I could not have had. I used to tell him that, his name fit him because he was wiser than most. And he always gave me wise counsel. And he always was thoughtful, considerate, and kind. I never felt uncomfortable asking him any question because he never made me feel like I didn't know what I was talking about. He was just guiding and helpful. I admired him for all those years he took care of his elderly mother. I was just filled with admiration for Dennis Weiser, and thank you and I'm sorry to his loved ones and Mary, and thank you for lending him to our community, because we were blessed to have him.
Thank you, Alder Land. Is there anyone else who'd like to make comments? Alder Lemke.
Sorry. So I would just say, just to echo a few things that other folks have said, I think that Alder Weiser was a person who took his service and work very seriously, but not himself. And I think in politics, people can get very, wrapped up in, the next thing they're trying to do or that kind of thing. And I never had the feeling that he took himself overly serious. He took his job obviously very seriously, but I think was a very sort of down to earth person. I also feel like I'm a person who can get, bogged down in the details of what's coming up in the city council or some issue. And he always encouraged, us to see the bigger picture of how things fit together, not get too bogged down in, to kind of not lose the forest for the trees. And also, just like Alder Tate said, I think one of the things that I'll always remember about Alder Weiser is the fact that he was kind of one of the first two people to reach out to me when I was on city council. When you don't have an exact idea of how city council is run yet and you're getting your feet wet, he's kind of a person who would be very willing to extend a hand and help guide people or explain the background of an issue that might have been long-standing. And so I'll always see him as a person who, kind of helped mentor a new group of people onto the city council. And so I very much appreciated working with him. And I'm, again, like people have said, my heart goes out to Mary, and I know it's a really hard loss.
Thank you very much, Alder Lemke. Anybody else who'd like to share? Alder Coe?
Say, I'm going to miss him. He was a very good friend of mine. Over the years, I used to call him a lot for advice on the council, and we bantered back and forth. And even if we disagreed on things, we were both very respectful to each other. And I'm going to miss his wisdom on the council. And my thoughts and prayers are with the family and Mary. Just want to say thanks for sharing. Thank you.
Thank you, Alder Coe. Alder Young.
Thank you, Mr. Mayor. Dennis Weiser represents leadership that leads with both the head and the heart. And I think we've heard a lot of folks talk about his incredible wit and not taking himself too seriously, but we've also heard them talk about his attention to the details that have moved this community forward. And so I think Racine is a better place simply because of Dennis Weiser, not only in his role in leadership, but his role as an educator. I met Dennis Weiser before I was voting age and came before the school board, and he spoke about the importance of getting involved in public service. And so that day on, I've always looked to Dennis Weiser as a role model for what it means to give back. And even before I was on the council, my early months of service, I reached out to him for counsel, and he will be sorely missed. And Racine is a better place because of his service.
Absolutely. Thank you, Alder Young. Anyone else who would like to offer comments? I don't see any hands up or hands waving. So with that, I'm just going to ask if we could just take another minute of silence in memory of Alder Weiser. Thank you, everyone, very much. Okay, the next item on our agenda is the approval of the council minutes of November the 17th, 2020.
Move to approve.
Thank you very much. Is there a second? Second from Alder Santiago, I believe, was waving his hand. Yes. Any discussion on the minutes of the 17th of November, 2020? Seeing none. Tara, if you could unmute everyone briefly. All those in favor of the minutes, please say aye.
Aye.
Opposed? That motion carries. We could then move on to the first committee report. The first item on the agenda is the Committee of the Whole report by Alder Tate II.
Certainly. Item 0810-20, communication sponsored by President Tate II to interview candidates and make a recommendation to fill the vacant 10th District Alder position for the remainder of the term. The recommendation is to appoint Sam Pete. I move to appoint Sam Pete effective immediately.
There's a motion on the floor to approve the appointment of Sam Pete to the 10th Aldermanic District. Is there a second on that motion?
Second.
Seconded by Alder Lemke. I believe had her hand up first. So we will give that to her. Is there any discussion on the motion? Seeing none, the clerk will call the roll. When she calls your name, please vote as you wish.
I have to unmute myself as well. This council meeting, we will be starting with Alder West. Alder West.
Aye.
Alder Coe.
Aye.
Alder Second.
Aye.
Alder Santiago Jr.
Aye.
Alder Levy.
Aye.
Alder Peterson.
Aye.
Alder Horton.
Aye.
Alder Young.
Aye.
Alder Land.
Aye.
Alder Perez.
Aye.
Alder Taft.
Aye.
Alder Mikva.
Aye.
Alder Lemke.
Aye.
That's 13 ayes, 0 noes.
Mr. Pete, congratulations. At this point, we will stand informal and ask the city clerk to swear you in.
Thank you. Alder Pete, if you could please stand and raise your right hand and repeat after me. I solemnly swear
I solemnly swear
that I will support the Constitution
that I will support the Constitution
of the United States
of the United States
and the state of Wisconsin,
and the state of Wisconsin.
faithfully
I'm sorry, part of it was garbled. I will faithfully
and impartially
and impartially
perform the duties
perform the duties
of
Alder of the 10th District.
for the
I'm sorry,
for the
after far, it's getting lost.
okay for the city of Racine
Or the city of Racine,
to the best of my ability,
to the best of my abilities,
according to law.
according to law.
Congratulations, Mr. Pete.
Thank you.
Congratulations, Alder Pete. Welcome to the Racine City Council.
Thanks,
you may-
everyone, Mayor and City Council.
Alder Pete, would you like to say a few words?
Well, thank you. Again, I feel very honored and privileged to be part of City Council, and I will do my best to help move the city forward. And it's very coincidental. I am taking the position that was once held by Dennis Weiser, who I also knew well. A very good, personable person. And as I was listening to the other members, I'm thinking to myself, if I can represent the district as well as he did, as I would feel that I've done a great job. And again, I thank you, and I'm feel privileged to be a part of the city council, a part of the team. And I'm looking for great things to help us move the city forward in spite of things like the pandemic, which seems to be the big challenge for all of us now.
Indeed. Well, Alder Pete, welcome. And without a moment to lose, that's a great segue into the next item on on our agenda. The first item on the agenda is, well, we have items under the mayor's report, but before we get to those items, we've asked Dottie K. Bowersox, the city's public health administrator, who, by the way, has been doing heroic work in battling the pandemic. Her and her entire staff have really exemplified public service this year. And what I'd like to do now is turn it over to Dottie Kay for a presentation on where we stand today with the pandemic. Dottie Kay?
Thank you, Mayor, President, Alders. Again, thank you for this opportunity this evening. I desperately hope that at some point in the future, there we are. I desperately hope at some point in the future we'll be all together in the same room without masks and not talking about COVID, not necessarily about any other communicable disease, but definitely not about COVID. So I have 3 other members of the Health Department with us here this evening. One is Bobby Fergus. She's the Community Health Director. The other is Cody Pierce, who's the Epidemiologist and Bioterrorism Preparedness Coordinator. Both of those individuals you've seen at previous presentations. A new face who's on our Incident Command team is Stephen Curtis. Stephen has helped with the presentations and numbers and such previously, but he'll also be presenting this evening as well. Next slide. We'd like to start with the international trends. When we had talked last time, just a short period of time ago, we talked about the possibility of the United States being the most COVID-ridden country in the world, and we do have that distinction at this point. The European nation has slipped below. India was a factor at the last. That has slipped way below. But again, within this comparison of the top 10 countries by data over a 7-day average, we have the most COVID-positive individuals in the world. Next slide. Going to the national level, we have a little over 13 million cases. That's up 8.4% in the last 7 days. A reminder with the testing and these numbers is that Thanksgiving Day, the day after, and then that Saturday and Sunday, there was very limited testing, if any. So testing started again for most jurisdictions on Monday of this week and continued today. So again, these numbers have had a downturn because of the lack of testing or the limited testing throughout the country. So again, a little over 13 million, up 8.4% in the last 7 days. The total increase since we were here on October the 20th is 164%. Again, non-household gatherings, seasonal weather changes, or limiting outdoor spaces are contributing to the worsened COVID transmission in the Midwest and Central states. The United States is averaging 159,000 plus new cases daily. That's 3 times greater than, again, when we were here for the October presentation. Cases rose sharply following Labor Day activities, and we're still in the recovery mode from Labor Day, which I'm not even sure I remember Labor Day at this point, but nonetheless, the numbers have continued to increase significantly since that holiday. Wisconsin is trending number 10 with 32,000 plus cases in the last 7 days. Next slide, please. Again, at the national level, as I've already mentioned, Wisconsin is number 10th in the country for the number of COVID positives. That's a little over 33 or almost a 34% positivity rate of those individuals that are being tested. If you take a look at where Wisconsin is in relationship to the population numbers or the population baselines of California, Illinois, Ohio, Texas, Florida, Pennsylvania, those populations are all much more significant than what we're seeing or what we have here in this state. So again, there's that imbalance between what we're seeing on the population base and the number of COVID positives that we have in the state right now. Next slide, please. I'm going to turn this over to Stephen. Stephen's going to come on up here. He's going to talk about the state of Wisconsin trends that we're seeing at this time.
Good evening, everyone. So moving closer to home here in Wisconsin, we're continuing to see excessively high levels of cases. As of today, we're a little over 391,000 cases, but as of yesterday, we were 387,000 cases, which is quite a bit of jump from our last presentation, a little over 200% of an increase. Last time we talked at the presentation, it was a little over 178,000 cases just over a month ago, which equates to about 5,000 cases per day since October 20th. Again, a sizable increase in percentage-wise. Those numbers reflect across the state. 90% of our 72 counties have a critically high case activity, which means that it's more than 1,000 cases per 100,000 population over a 2-week period. The previous category, which this one replaced, was capped out at more than 350 persons per 100,000 population. So quite a sizable change in the category to accommodate the increase in cases. Reflected in those cases is the occupancy of hospital beds and ICU beds, which are both above 87%, accommodating another 25% of those individuals who are occupying those ICU beds as needing a ventilator.
Yeah, and today we received notification from one of our healthcare partners that giving us a critical staff shortage notification. So again, one of the things that we've talked about repeatedly is the necessity to protect our hospital systems as well as our police fire systems. And again, we received notification today that they're experiencing critical staff shortage.
Next slide, please. All right, so similar to the international graph, here we have Wisconsin trending in relation to the rest of the Midwest states. You'll notice we have a kind of a funky blip there around minus 42 and between 35. That's reflected as a maintenance event for the disease surveillance system, which those higher counts, keeping in mind this is a 7-day average in the line that you're seeing, is just a lag in those cases being brought on as quickly as possible and then slowly being moved out of that average. But as you can notice the trend, we've spiked. Illinois spiked above us. Ohio's above us, Michigan's above us, Minnesota, and we've come down quite a bit. But bearing in mind that we're just coming off of Thanksgiving season here, we'll see what the weeks ahead show us. But we are coming down from that, but we are still relatively high in relation to other states. We're just sort of middle of the pack at the moment.
Yeah, and to clarify, the dip and the spike and another dip, the Wisconsin Electronic Data Systems is the system that we utilize and that the hospitals and the laboratories utilize to report the number of positives. And during this time frame, there was maintenance. The system was not built for a pandemic. It was built for day-to-day activities within the framework of communicable diseases. So in order to maintain that system, they had to enhance it. And during this time frame is what that happened. So then those cases were not readily reportable to us. We had a time frame in which we had the lag. And so you see that significant dip, and then we've got an increase and then another dip with that.
Thank you. Next slide, please. All right, so looking at the 72 counties, the darker blues are our higher cases per population. This is over the entire course of the pandemic, not just a 2-week period. So this is taking into account the number of cases in total that a county is taken on since the start, but also adjusted for the population that they represent. So noticing that all our top 10 are not necessarily in the Southeast region anymore. They continue to be around Brown County, as well as out west near Eau Claire in the La Crosse area there. But keeping in mind that currently the city of Racine County, is 21st, and we moved to 24th as of today. And our current rate is a little over 7,200 individuals per 100,000 population. Next slide, please. So just to illustrate something that we haven't done before, there's a web page that animates the progress of the pandemic across the nation, but in this video we've concentrated on the state of Wisconsin. And if you follow the cursor in the video, it will be just off the coast of Racine County, and you can see our progress throughout the pandemic in the number of active cases adjusted for population. So if you could play the video, please. Notice that the darker the color gets from a light blue to a purple hue, the worse off you are. So we go through a little bit of our early stages, April into May, where we start to have lockdowns and shutdowns. June, we loosen up a bit. Then we implement safer racine. From there on, we see 4th of July, August, Labor Day. Moving into October here, everything just kind of starts to close in, and that portion around Brown County gets worse, and you can see gradually it overwhelms most of the Midwestern state counties. But as a demonstration to play the video, you'll notice that throughout the majority of this pandemic, we've managed to hold pretty moderate ground on this virus. So hopefully this is a good demonstration of the work that we're doing. And then I believe I will be handing it back to Dottie K.
Yep. Cody Pierce is going to come to the table now, and he's going to talk about specifically the numbers on the city of Racine. Now that we've talked about internationally and nationally in the state of Wisconsin, now we're going to talk about the city.
All right. Hello, everyone. So on this table, you can see data as of Friday at noon, so they're a little bit out of date. You can see that we've had some pretty significant increases from previous updates in cases. And actually, as of this afternoon, we have a total of 5,921 confirmed positives in the city's jurisdiction, and a total of 56 deaths. So in about the past 10 days, 8 area residents have died from COVID, which is a large increase. We haven't seen that many deaths previously, and it's a trend that's being echoed elsewhere in the state as well. So if you want to go to the next slide, please. It's a chart that we've seen in previous updates, obviously with more updated data as of the past few weeks. You can see that following the trend of the pandemic, the city's jurisdiction, which is the lightest gray line on the graph, compared to the rest of Racine County, which is the middle gray, or the jurisdiction of the Central Racine County Health Department, which is the darkest line. At the beginning of the pandemic, we had a significantly higher case rate than the rest of the county or the other health department's jurisdiction. Following the implementation of some of our protective measures, like Safer Racine, we brought our case rate down pretty much in line with the rest of the county, and ever since have pretty much fallen right in line with the rest of the county. You can see some spikes there in the middle of summer, and then following Labor Day on through Halloween and up to the present day, where we see that decline. And again, it looks like promising news, and hopefully it is, but with the decrease in testing, and since these data here are, it's essentially just based on positive test numbers, when we have less testing going on, it can kind of falsely decrease the case rate. So you see that decline there, but again, as Dottie K and Stefan both mentioned, Thanksgiving last week resulted in a lot less access to testing, specifically with National Guard testing sites being closed for 4 days in a row. A lot of area residents who rely on that testing didn't have access, and so we expect to see case numbers normalize this week and in the coming weeks.
Yeah, and actually we've already seen that. So yesterday, the state reported that there was a little over 1,000 positive cases. Today, it's over 4,000. So the expectation is, because of all the activity over Thanksgiving, for those individuals who traveled, for those individuals who did not stay home and celebrate in their own structure with their own family who lived with them, that those numbers, as Cody said, will increase to what we've been seeing before.
Next slide, please. So here, again, as was mentioned earlier by Stefan, you can see that our case rate is about 21st overall in the state, with a little over 7,200 cases per 100,000 residents. Locally, the city's case rate over the last 14 days has dropped to about 972 cases per 100,000 residents. Again, that sounds like good news, but with the decrease in testing, it's a little bit too early to tell. So we'll be watching to see how things change in the coming weeks. With testing normalizing again, and that's compared to the state overall at about 1,200 new cases per 100,000 over the last 14 days. Some good news that we see here at the bottom. is that while at the beginning of the pandemic, our jurisdiction held the bulk of the cases in Racine County, about 70% of them in May and June. With our protective measures like Safer Racine, we managed to drop that to 58% of the cases in the county being in our jurisdiction in August, down to 42% in October, and just a slight increase in November to 45%. That being compared to the city's jurisdiction encompassing about 40% of the county's population. So we're much closer to being, our own proportionate share of the cases in the county compared to where we were earlier this year.
Which is a significant percentage. I know we've talked about this before, but for the population and the density of the city, being obviously the 5th densest city within the state of Wisconsin, being able to stay within these perimeters of what the base of our population is very important to be able to mitigate the spread of that disease.
All right, next slide, please. So since October 20th, we've seen an increase of nearly 2,800 cases in the city's jurisdiction compared to previous updates. On September 11th, we had 2,239 cases. October 20th, we had 3,078, and as of last Friday, we had 5,839. So you can see that, over about a 5-week time period between the two updates there, we've had a significant increase in cases from October to November compared to September to October. And we've been averaging about 67 new cases per day since that October 20th update. Previously, we were averaging only about 22 cases per day between those two updates. So our contact tracing efforts, because of that increased caseload and just the general inability to complete full investigations like we would want to, we've been using modified investigative methods to handle that increased positive caseload. And that kind of helps to deal with a wide, variety of caseloads that may happen from day to day, where one day we may have just a handful of cases reported, and the next day we can have dozens or upwards of 100 or more cases reported. So that modified, shorter investigation helps to make sure that we can make contact with as many residents as possible to, get those contacts and notify people who need to be tested or quarantining and isolating. And we continue to prioritize notifying our positives. So next slide, please.
As Cody just mentioned, as far as the prioritization, we did announce to the community that the priority is 65 and older, 18 and younger, those individuals that are living in congregate settings, and then all other positives past that.
All right. And on this slide, you can see that the largest increases in cases that we've seen have been in age groups between 25 and 44, and between 45 and 64, so kind of young adult through older adult age groups. However, we have seen increases in cases recently in all of our age groups, from infants and children all the way up through 65 plus. In our jurisdiction to date, we've seen 112 outbreaks in various settings. This includes schools, both public and private, where we've seen a total of 20 outbreaks. That's since the start of their school year in late August or early September. We've seen a total of 18 outbreaks in various government entities, which include city, county, and other governmental bodies in that jurisdiction. Total of 16 outbreaks in retail, commercial, or service industry settings. Another 16 in congregate living settings, which includes long-term care facilities like nursing homes, assisted living facilities, as well as correctional facilities, jails, detention centers, and then group homes as well would fit into that category. Outbreaks tied to restaurants and bars, we've seen a total of 15 of those. Outbreaks in factories or manufacturing settings, we've seen 15 of those as well. Outbreaks tied to medical or healthcare settings or providers, we've seen 7 of those since the start of the pandemic. And tied to social gatherings, which include parties or recreational leagues like pool or darts or bowling, that would be, we've seen 5 outbreaks since the start of the pandemic.
Okay.
Next slide, please.
Next slide, please. And Bobby Fergus is going to come up and itemize some of the alterations and changes that we've had recently with the Safer Racine.
Good evening, everyone. Some of the changes that took effect on November 27th where that's our long-term care facilities, we're no longer providing group activities or communal dining. Outside visitors were only allowed for compassionate care, end-of-life care. As far as K through 12 schools, the buildings were closed to students, faculty, staff, and administrative personnel. That is to take place through January 15th, and then once they would reopen on the 16th, we would be in phase 3. Child care centers, day camps, summer camps, there's to be no interaction between the groups and classrooms for students and staff, and no more than 15 children per classroom. Our restaurants and bars have been reduced to 25% of indoor capacity. This is excluding the employees. Next slide, please. Indoor recreational facilities reduced to 25% of our indoor capacity, again, excluding employees. Personal care establishments have been reduced to 50% of indoor capacity, excluding employees. Our lodging facilities prohibit guests from congregating in lobbies or other common areas. Faith-based services, religious entities, and places of worship. Our special events are limited to 50 people on those premises. Next slide, please. Licensed swimming pools and splash pads have been reduced to 25% capacity of premises. Indoor places of arts and cultures have been reduced to 25% of indoor capacity. Outdoor places of amusement and activity, special events have been limited to 50 people on premises. Indoor and outdoor mass gatherings in public venues have been closed for the current moment. And then indoor and outdoor mass gatherings in private venues have been reduced to 25% indoor capacity, excluding their employees. Total persons on premises is limited to 25% indoor capacity, or 50 persons, including employees, whichever is less.
Okay, next
slide.
Yeah, I want to clarify too, on the places of worship, the 50 is the number of gatherings, so special events. They are at 50% indoor capacity based on their occupancy permit. So it's a twofold. Again, those gatherings, special events are at 50 people, but the places of religious places of worship are at 50% total indoor capacity. So within Safer Racine, I know you've seen some of these before. It reduces the potential for exposure within the city of Racine. The more interactions, the greater risk of transmission. So we have seen this across the United States. We've talked about this internationally. We've talked about it nationally. We've talked about it statewide, and we've talked it throughout about the city, that we're simply not staying home. If you've seen any of the national or local news over the Thanksgiving holiday, the airlines in particular have not had that much activity since the spring of this year. They had not called back all their laid off employees, so there was longer waiting times in the terminals, longer waiting lines to get through security. The planes were full. We traveled again at a level that we haven't seen previously since the spring of this year. Individuals did not stay home and celebrate that holiday with the individuals which they live in their home. We've seen individuals that during the Mass, they're not wearing them appropriately. They're not keeping the 6-foot distance. At the same point, the Safer Racine conserves limited public health resources. It allows emergency services to respond, minimizes the impact of local healthcare systems. As I've already said, we have received notification of critical shortage of healthcare personnel this afternoon. At the same point, we've already gone over the numbers about the capacity of the hospitals at this point being in the upper 80%. Maintains consistent public health messaging, and it's the uncertainty of state and federal guidance and orders. At this time, almost on a daily basis, again, we're seeing changes within the CDC, we're seeing changes at the state, we're seeing changes at the federal level. We have a new administration obviously coming in at the federal level, and I'm confident we'll be seeing additional changes through there. The other venue on this, we have got COVID on one hand, and this is influenza season on the other hand. So those precautions that we're talking about for COVID are also applicable for influenza. At this point, only 36% of the population of the state of Wisconsin had been vaccinated against influenza. Last year, we saw 42%, which neither number is good, but I'll go with 42 over the current 36%. For influenza, last year we saw across the country between 24 and 62,000 individuals who passed for the disease. At the same point, for COVID, at this time, we're at over 278,000 individuals who have passed with COVID. So as we do not distance, as we do not wear our masks, as we do not maintain those guidance that we've been talking about for months and months and months, and go into this holiday season, not only do we have COVID, but we have influenza, with the two of them potentially impacting, with the understanding that our healthcare systems are already stressed. It is a dilemma that we've talked about for months and months, worried about that this was going to happen, and it looks like we're here. We're not getting the influenza. We do have vaccine opportunities that will be coming next year for us, but again, individuals need to be vaccinated for COVID as well as for influenza, as well as the mask and distancing, for us to get back to some level of normalcy, whatever that means for us at this time, in combination. So again, we have to look at this collectively throughout the city, throughout the state, throughout the nation, to try to figure out what's going to happen next, seeing that, we don't have a guidebook on this. We haven't done pandemics before. We're all doing the very best we can under exceedingly difficult circumstances for everyone. And I can only hope that once the vaccine arrives and is available, that individuals will get vaccinated for COVID, just as hopefully they will continue to get vaccinated for influenza. So that concludes our presentation at this point. We're delighted to take any questions.
Thank you very much. Annie, if you could stop the screen share just so I can see my colleagues all at once. So I just, before we start doing questions, we have a robust agenda in front of us. I've been reminded by some of the council members that typically speaking on any one matter, people are allowed to speak twice to a topic. And so if you have questions, please make them concise. This is an important topic, and I want to make sure everybody gets a chance to ask questions if they have any. And I would just say, obviously, with the extension of the two orders that we have before us, if you have questions about those items as it relates to the presentation we just heard, now is your opportunity to ask Dottie Kay and her team those questions. So any questions or comments from alders? Alder Tate, did you have comments or questions?
Yes. Thank you, Mr. Mayor. I guess my first question, I have a few. We had the slide talking about the number of outbreaks, I think 122. How is an outbreak defined operationally? What constitutes an outbreak? Saying as schools were identified as the highest factor for outbreaks, like what does that actually mean in practice? How many people are being affected, and what's the data that defines an outbreak?
Sure, Alder. Thank you for that question. So the definition that comes from the CDC or the Department of Health Services at the state level defines an outbreak in most settings, which would include schools and workplaces, as 2 or more cases identified where there is a link of transmission, or what we call an epidemiological link, between those cases, so we can see that transmission happened in that setting. The exceptions to that definition are those congregate settings, so long-term care facilities or jails, for instance, where one case would be defined as an outbreak just because there is a much greater risk of transmission to others in that setting.
Okay. And is there a particular window of time within which that outbreak is being defined, such as like if there's transmission between 2 people, how much time must elapse before that outbreak is determined to have ended and perhaps another one occurs?
Sure. Yeah, great question. So for an outbreak to end, we look for 2 incubation periods of the virus. So in this case, that would be a total of 28 days or 4 weeks from the last onset. So that gives time for anyone else who was exposed and to present with symptoms, or maybe who may be asymptomatic, to possibly pass it on to somebody else who would get sick. So we would watch for anyone else to develop symptoms in that same setting within a 28-day period, and if that doesn't happen, then the outbreak would be closed.
Okay. So I guess part of me is wondering, when we saw that statistic of 20 schools had outbreaks, obviously they haven't been in school that long, really. I think maybe 3 28-day periods at this point since Labor Day. So, I mean, can you define or at least kind of describe, what that looks like? Is that happening at numerous schools, or are there clusters occurring at different grade levels, or like how are we defining that? Because it seems like that if that's the relatively broad definition, I'm not gonna say broad, if that's the definition of an outbreak, the narrow definition, it seems like the circumstances within which this is occurring is pretty specific, and I guess I want to say not unique, but it's kind of challenging to define. So I'm just curious to kind of understand that a little bit better.
Sure. So, and to clarify too, these cases are happening among both students, faculty, and staff at the schools. So it's not solely students, and it's across all of our public and private schools. Not to say all of them have had outbreaks, but it's across both public and private institutions in the jurisdiction. So it's kind of what you mentioned, so clusters of cases at different grade levels. It's possible that there could be outbreaks simultaneously in different places in a school where maybe one classroom has an outbreak and then another classroom that does not have a defined link could be having an outbreak elsewhere in that school. So that could be what we're seeing.
All right, great, that makes sense. And then my last question is, I spoke to Public Health Administrator Bowersox, just last week or so, about the kind of connection between holidays and the particular restrictions that are coming. And I just wanted you to maybe speak, kind of expound on the rationale of these particular changes as it relates to the data and the trends that have occurred prior, up to this point during the pandemic, and why it would make sense, or at least why you would justify, this is happening right now, and this is why these particular interventions need to be in place based on what we've seen happen.
Go ahead.
Oh, yeah. And thank you, Alder Tate. So what we've seen over the history of this is that we've seen Easter holiday, we had a 700% increase. Memorial Day, not as much of an increase because we had the forward racine that went into place. 4th of July, we had about a 500% increase. And then with the Labor Day, we're still seeing that surge. So we've got a downtick now because of the lack of testing over this short time frame. But again, I'm still experiencing that surge from Labor Day. So again, as individuals gather, as individuals don't wear their masks appropriately or consistently, if they don't stay home when they're ill, then they're spreading the virus, and those numbers just keep increasing. And again, from the national as well as the local media, with the reports on the traveling and that individuals interacted with individuals that were not in their household, based on the previous holidays and the closeness of Thanksgiving and Christmas and New Year's, it's to be expected or anticipated that we'll continue to see those increases.
Okay. So let's say someone's like, I don't get what that's got to do with businesses' capacity. Can you kind of put it as plainly as possible why holiday gatherings and the spikes associated based on historical trends, what's the correlation between why business capacity has been decreased, or numerous things capacity has been decreased? As plain as you can for those who might not, be processing or getting it.
Yep, and we're looking at those venues in which there's gatherings of individuals, where individuals are meeting, that are getting together, and they're not being responsible with the distancing and the masking, and they're transmitting the virus.
And I guess I'll just finish my last comment. No more questions, but my last comment is just part of the reason why the rationale is for decreasing the capacity is because there's going to, effectively what we know by now is when a holiday occurs, there's going to be a spike because people don't do what's responsible to do and taking the proper precautions to prevent spread. Because they do that, the only response we have in reaction is to prevent gatherings where it spreads further, which is the business capacity side. Nobody wants to shrink business capacity, but because people aren't doing what's necessary to stop the spread, the only option is, well, we can't have them gathering in these spaces. That's all that's left. So, without going on a diatribe, it's just that obvious. We talk about, people having personal responsibility. We're here because people aren't personally responsible. And we'd love to go back to people being able to be personally responsible so we don't have to put restrictions in to make up for personal irresponsibility. But here we are. Thank you, Administrator Bowers-Fox, for all your efforts and your team to try and get this information out and into the community and to make sure that we're educated so that we can make healthy decisions. But my God, please, City of Racine residents and everybody else in this state, stay home, wear a mask, don't gather, stay within your household for the holidays. I forewent being with my family because it's the right thing to do. Please do the same so we can actually have a holiday next time without missing people. Thank you.
Oh, thank you.
Thank you.
Well said.
Thank you, Alder Tate. Alder Peterson. Oh, hang on just a second, Alder Peterson. We got to make sure you're unmuted. My apologies.
Yes, a couple questions. Curious why teachers and administrators aren't allowed in the buildings, yet you still allow up to 15 kids in a child care. Especially if the teachers and administrators are wearing masks in their own space.
Administrator Bowers-Fox.
Oh, thank you, Alder. So within the schools, they are allowed for essential services. So like payroll and maintenance, if they have legalities, the operation is the foundation for the services themselves. At the same time, what we're seeing, if you take a look at the numbers, again, we were seeing those outbreaks within those institutions.
I'm talking about teachers being in their classroom, being able to use their chalkboards, isolating themselves with a mask. Yet you have 15 kids in a child care, that's acceptable.
Sure, and at the same point, when we were looking at the outbreaks within the schools, we were seeing them within the faculty as well as the administration.
Right, but that's when everybody's in the school together. We're talking about just administrators and teachers going into schools, being able to sit in their classrooms.
So Alder Peterson, I just want to, the intention here is not that it's going to be a back and forth debate with the administrators. And so if you have a concise question, please ask it. Give the staff an opportunity to answer the question, to give you clarity on what we're debating tonight.
Okay, thank you. Which healthcare provider is experiencing the extreme shortages at this time?
Well, across the state of Wisconsin, in particularly in the southeast region, all the hospitals are experiencing shortages. So there's, for beds as well as for staffing.
Right.
And it's not only the state of Wisconsin, but across the country.
I'm talking locally. You stated local providers said they're experiencing critical shortages. Who was that locally?
Locally, that would have been Ascension. But that, again, is throughout the southeast region. Okay.
And you put in your in the attachment, it states that eradication can be effective if 70% of the public consistently wears surgical masks. I, myself, my family will wear them constantly. Wouldn't you think if 100% of students wore their mask and faculty that it would be effective?
Okay, so masks are only effective 60 to 80% of the time if they're worn appropriately, which means they're not under the chin, they cover both the mouth and the nose, they're not dangling from the ear, they're not in a pocket, they're in a hand, and you don't have to hitch them up as you're speaking. They have to be snug and secure to the face, they have to be disposed of and or cleaned appropriately. So again, they're only 60 to 80% effective.
Right, I'm just quoting what you had written in your attachment here about if 70% of the public consistently wear their surgical masks, when most of the students, I believe, are at this point in time wearing them 100% of the time. It appears that from June 22nd or thereabouts, we have mirrored the county with caseloads as far as we're 40% of the population, they're 60% of the population. We have 40% of the cases, they have 60% of the cases. Do you think that, I understand with the density of the city, it's more challenging, but do you think that being that we have two different thought trains or two different health departments, that any of this actually does much of anything, being that we've been mirroring them since June 22nd?
Cody, you want to do that one?
So thanks for the question, Alder. So I think the point is kind of in your question there. So the fact that we have been mirroring them while we've had these protective measures in place is kind of our evidence that it is working. Beforehand, when we had the state's safer at home order back at the beginning of the pandemic into May, when things were kind of an even playing field across the state, let alone across the county, that was when our cases were much higher, when our case rate increased much faster than the rest of the county. Then when things changed and we had the protective measures, but they did not, that is when our case rate became more in line with what the rest of the county was seeing.
All right, thank you very much.
Alder Perez.
Ms. Barasak, what is the difference between people attending church at 50% and 50 people at an event at church? Because wouldn't they at church also follow the 6 foot and the guidelines for capacity? What's the difference?
Yeah, the special event. So church carnivals, special events throughout Safer Racine, the 50 people, we were at 100. We reduced that to 50.
So so does that apply to things that don't happen inside the church, as opposed to, because the comment that was made from some of the congregations in my district were, okay, so we're having a wedding. If that must be a special event, so we can only let 50 people into the wedding, as opposed to having a church service where our capacity is 300 and we can let in 50%, 150 instead of 50. How is that different is the question that was posed to me, and kind of what I was wondering about too, because you maintain the distancing and the masks and everything else. How is that going to be different, or is that
Right.
not what that means?
Yeah, no, the concept behind that is that you wouldn't have the 50% and you'd have another 100 individuals there on top of that on the property at the same time. So then you would increase that number significantly.
Could you repeat that one more time, Daddy K? I was
Sure.
a bit confused by that answer.
Yeah.
Oh, yeah, okay, sure. Steph, do you want to? Let's Steph and try to.
I apologize if, so in looking at the 50% in terms of things like weddings, funerals, is to try to be as fair as possible and recognize as well is that those are unique, events that are scheduled. They're not part of the regular worship service of those faith-based service organizations. So they may be doing things a little bit differently. So they may be serving food, which implies that people may not have masks on. And what may be challenging then is if we say 50% of their venue is, say, 350 people, it could be 175 individuals who may not be wearing masks, which presents a challenging situation during the middle of a pandemic. So across the board, taking into consideration the private venues that might be having these kind of events, it was also translated into the faith-based services who also share some of their wedding halls, their dining halls, community halls, where they might actively bring individuals from outside their congregation or within their congregation in large volumes, most specifically to be concerned about situations where they might not be wearing a mask, such as consuming food or drinking beverages of some sort. So that's to fall in line with our private venues. The faith-based services for their special events would follow suit. So they're essentially equal in all circumstances, and with exception to those understanding moments where obviously we want people to practice their faith. That's why they're still allowed to participate at 50% capacity, which I don't believe has changed since we brought this ordinance into effect. So
I understand that, but so what you're saying is that by your explanation, what I'm taking away is that 50 people at an event where there will be eating and not mask wearing then? Is that what you said?
That's the assumption, which is also why we decreased the restaurants to 25% as well. So we're looking at overall decrease of those higher risk activities and the number of people who may be involved in them, so that we don't have further outbreaks in settings that may be higher risk, such as our churches, which may have large capacities, or our dining halls in private venues that may be larger. So hopefully that explanation helps.
Yeah, no, it just muddies the question a little bit. I understand that, you know, all the churches, at least in my district, are following the rules at 50%, wearing masks and so forth. But to limit another event at the church, by implication, you're saying that they're not going to follow the rules, so we're going to limit it to 50 people of not following the rules. That doesn't make any sense.
Not to be argumentative, but to explain, so that event that the church is holding is the same as a private venue that is not faith-based, which is still held to the 50-person standard, that is participating in a similar event, such as a wedding or some sort of banquet event or gathering of individuals not related to the worship service.
Okay, I get your point, but I would say 90% of what happens at church is faith-based. So your premise, I think, is off. As a pastor myself, I can tell you that the purpose of church is to have church events there. Okay, I'm going to move on. Ms. Bowersox, how effective then was the order, the Safer Racine order, since it was implemented? Is there any way to gauge that?
Cody, you want to go back to?
Yeah, I mean, maybe we could ask Annie to share the slide again that sort of had those points in time where we implemented our ordinance and the rates that decreased. I don't know if that's if Annie's still there and can do the screen share to be able to do that. But Alder Perez, I think the presentation had a pretty good illustration of those points in times when we were putting in effect Safer Racine or the mask ordinance or what have you. So
what I'd like to hear Ms. Bowersox say is, yes, they were effective, Alderman, and we see and continue to see the effectiveness of its use. If that's what you're saying in the slide, just want to hear Ms. Bowersox say that.
Yes, Ms. Bowersox,
Annie, if you
say
could,
that.
yeah, and Annie, if you could
Yeah.
scroll ahead to the to the slide that sort of had those points in time, so that Cody or Dottie K can reiterate that question. Because I just want to make sure that people can hear it and see it, because it's an important question that you're asking, Alder Perez.
Right
There we
there,
go.
Ann. All right, again, we've got the timeline there. Cody, do you want to just talk about the 40%? And
Sure. So, and just to preface this, it would be great to be able to say that we have hard and fast, concrete evidence to say that yes, 100% we know this is working, but we don't have a way to know, of course, what would be happening in the jurisdiction without the ordinance. All we can do is compare to what we've seen in the past, prior experience, and that would be that first spike that you see there, where the restrictions were the same across the county. So they were the same here as they are out in Burlington, for example, where our case rate was astronomically higher than the rest of the county, as much as I think, 4 to 5 or even more, 4 to 5 times greater cases on a daily basis that we were seeing compared to the rest of the county. Our measures took place in May. The Safer Racine ordinance coming into play then, and we see that our case rate has pretty much mirrored the rest of the county. So again, we can't say with 100% certainty that yes, that is the reason why, but that is what we believe based on the data that we see here, that when the ordinance and the protective measures came into place, that we did see our case rate drop, and it has followed the trends of the rest of Racine County and the rest of the state of Wisconsin as a whole.
so, and Alder, some of the numbers that we've seen, so for the week of November the 30th, the city of Racine had 5,905 confirmed cases. The county had 13,155 confirmed cases. That was an increase during that week for us for 279. They had an increase of 726. So we had 618 probables. They had 1,453 probables. We had 55 deaths, and they had 166 deaths. So again, looking at those numbers, they are significantly more than what ours.
It's an important question, Alder Perez, that bear going through a second time. Annie, if you can unshare the screen so I can see all the participants again. I see Alder Tate had his hand up again, but I just want to make sure nobody else. I'm going to go to Alder Taft next.
Thank you. I guess I had a question about compliance. I mean, I think what I've been hearing from you all is that the reason that we are here is because, unfortunately, this issue has been, politicized, or there's been a lot of disinformation. And so people are not complying with the things that we need to do to keep it under control. In your experience, when you call people with positives, is it, do you get pushback? Are there people that get the news that they're positive and continue to go, but don't quarantine? How do we have the capacity to enforce these things? And the reason I'm asking about this is because I think if we're still having significant non-compliance, that's all the more reason that we need to support these efforts legislatively, unfortunately, because people aren't doing what they need. I just wondered if you could speak to that a bit.
Sure, I can speak on that. So as far as the contact tracing with notification of our positives, for the most part, people are being compliant. They're going through their investigation, and we're being able to complete their interviews. Through our investigations, we're finding out, though, that, not many people are socially distanced and staying at home. They're still continuing to do their day-to-day activities. They're very honest about that, which helps us with our contact tracing. The one problem that we are having, though, is that people are not necessarily always telling us they're close contacts. So then we're not able to necessarily make notification of close contacts. If people are non-compliant with isolation or quarantine, the health department we do have the ability to place orders. And our police department has been helpful if we've had to place any orders on going out with us to deliver those orders. Does that answer your question?
Thank you. I mean, I think it's important that we have a full picture of what the reality is like. So I appreciate that perspective. Thank you so much.
Sure.
Thank you, Alder Taft, for that important question. I will just say on behalf of our public health staff, not everybody who they call to do contact tracing is always kind and respectful. And we've had public employees that have done really good work of enduring that regardless, to do their best to contact tracing and do the best to mitigate the spread of this pandemic. And so I just want to acknowledge that work that they've been doing in earnestness for several months now. And I know it can wear on them. So I want to thank them for that. Alder Tate. You're still muted.
I had a couple questions or clarifying points. I think one of the things that kind of stands out in terms of how Safer Racine has evolved is really reflective of what's supposed to happen when you learn more about a novel virus. Particularly, I think as Alder Perez was kind of asking, well, what's the distinction here between a worship service and an event? What we do know is that a worship service is a particular set of activities, usually singing, listening, maybe sitting in relative proximity to one another. But that's kind of the extent of what consists of a worship service. However, events, as was noted, include food, eating, and these sorts of other things. And what we've learned over time is the distinction of events that ultimately serve to propagate or perpetuate the virus. And I think it's important that we acknowledge that the ordinance, as it's being updated, is taking into account what we're learning about the spread of the virus. Okay, when people gather and maybe they're wearing a mask and a bunch of them are talking, it doesn't necessarily turn into an outbreak. But when they do gather and they're eating and drinking, that does turn into an outbreak. And I think that's reflective in some of the changes that are here before us tonight. So I think it's just important to really make that distinction of, as we go, we are learning a lot, and we are pinpointing where things are happening, how they're happening, what activities they're happening under, some such as like how we know what's happening at the schools. We know that every holiday there tends to be a spike because people just won't do right. And then we know that kids are going to go back to school after that holiday. And because there's a spike, there's probably a lot more positive kids going to be going into that school, spreading the disease, or teachers or administrators. Therefore, the smartest thing to do to slow that spread is let's just not have them go back during this 40-day window of 3 major holidays, because we know so far people just aren't going to do what we need them to do. So we have to do what we can do outside of them to kind of slow the spread. So as we learn more, we're doing more and getting much more specific in our interventions. And I also think from a legislative perspective, that's exactly what needs to happen, is that when earlier we were very broad in our response, right? Everybody just stay home. We don't know what to do. Don't go anywhere. As we learn more, we're like, okay, staying home is best, but you can do X, Y, and Z. If you go out, you should wear a mask. You should social distance. You can do all these sorts of things, but here's what has to be in place in order to do them. My one question is, does the data reflect the impact of the various legal challenges that have happened in the state of Wisconsin as it relates to the measures that have been implemented, whether from the governor or local municipalities? Because it seems like each time there's an action made to try and slow this down, and there's a legal reaction, that ultimately blunts the community's response to compliance with that. Does the data bear that out?
I don't know if the data, Alder, that's an excellent question.
I mean, I think it's worth saying with respect to what Alder Pate is bringing up, is that we haven't made a step backwards.
Stephen, we can't really hear you. You have closer for us to
Thanks,
hear.
Mayor. Yeah, he's coming up.
I apologize. So, going back to what Cody said, it's hard to pinpoint exactly what percentage of reduction we expect to see from safer Racine and from a mask ordinance. There's those private settings that can be a little bit more challenging, where you're with maybe an uncle and aunt, or a grandparent, or a sister and their sibling, their children. We don't know what happens in those events, but what we can see is that we're more in line with the county. And with that, as far as, I lost my train of thought. So,
all right, you're doing good.
No, it is to say that with Safer Racine, I apologize.
That's okay. We'll give Stefan a moment here, but I do know, Alder Tate, is that when we have these alterations, when we have the judicial, we have the suing, we have that, it's very confusing to the public to know what they're supposed to do on Tuesday versus on Wednesday. We get information that's placed in the media that is not always accurate. We communicate, we send out information on a regular basis to the businesses and schools and such, but at the same point, it adds to a lot of confusion when this happens. And then if we take a look at our mask ordinance, for example, it was in place before the state's mask ordinance. When we take a look at Safer Racine, we're only of just a few jurisdictions literally in the state of Wisconsin. Any of the other orders that have come through the governor's office have been challenged and have not been implemented for any length of time, with the exception of the mask order at this point, which will go until 2021. But at the same time, it's been up to local jurisdictions to look at the data and decide what they need to do best based on their community, their projections, and on the data that they can accumulate, which the state of Wisconsin is home rule, for the jurisdictions. It's been difficult because the assistance at the state level has been minimal, and it's been after the fact more so than before the fact, as well as from other federal agencies in which the information changes on a regular basis. So it's, if anything, it's just added to confusion.
Okay. Thank you for speaking to the confusion piece. I guess part of my interest that maybe in the midst of doing our contact tracing, as Alder Taft kind of alluded to, are we kind of asking questions that relate to information that individuals have received as it relates to COVID, or kind of what they've internalized in terms of what they believe or what they've heard, so that we can kind of get a better understanding of how people are getting exposed, or if they're not necessarily taking the proper precautions, what sort of thoughts or information is influencing those actions.
So through our contact tracing and doing our investigation, we do, we'll answer any questions that the residents may have, provide additional education if, what they've been told or what they understand is different than the public health guidance. So that can be very helpful. We have many people that sometimes the interview process can be very long. It can take anywhere between, an hour and sometimes honestly 3 hours if we're using a language line to get that done. We can call one positive and we can find out that in that one household, they might have 4 other people that are ill, and we have to make those probable cases and do investigation on each and every one of those individuals. So, it can be a very long process. So we always follow up with an email with the education in it, the public health guidance, guidelines on isolation and quarantine for both the positive person and their family members, recommendation of testing, and then we do call back to check on them to make sure, if they have any questions. It's a lot to process at one time, and sometimes it can be overwhelming for somebody. So once they have time to digest all of the information, read through our emails, the majority of the time we have people that will call us back and ask questions. So I will tell you that, I can appreciate people being honest about where they've been, whether it's been a baby shower or they were bowling. I mean, this is right. We're not trying to tell people they can't do these things. We're just trying to make it safe, by wearing a mask, hand hygiene, staying home when you're ill. And currently right now, a head cold could be COVID and you wouldn't know. So those things that we used to go out and about and just, struggle through and get through, we have to just be a little bit more conscious and stay home when we're not feeling well.
Thank you.
Mm-hmm.
Thank you. Alder Taft, you had your hand up. Is that from before, or did you have another question or comment?
Sorry, that was before. Sorry about that.
Okay, great. And then Alder Perez, your hand is up. Did you have a follow-up question?
So 2 things that I'm trying to understand, and that I think President Tate touched on momentarily there. First of all, I have a completely different understanding than President Tate on what worship is as a pastor, and having studied it and being in that field. So I just want to lay that out. But second of all, Ms. Bowersox, what's the relationship between the order and the current legal challenges that are out? How does that affect the orders, or does it affect the orders? Can you expound on that a little bit?
Yeah, and I would defer to the city attorney. Scott, are you on the line?
Yeah, let me see if I can, ask Tara if the city attorney is available to unmute to answer that question.
Mr. Mayor, Alder Perez, I am here. I want to be a little bit careful in responding, because these legal actions are still pending, and I've never believed it was appropriate for an attorney to publicly comment on pending litigation. But I will just say that the Supreme Court enjoined enforcement of the health department's school building closure order, did not say it's illegal, just enjoined enforcement while the lawsuit regarding that order is pending. The Safer Racine ordinance is a different thing with different enforcement capabilities. Safer Racine ordinance is something that's passed by the Common Council under its legislative authority, and if you know what I mean by home rule authority, there's constitutional and statutory home rule authority. So the ordinance is in place. It's a different thing, again, with different enforcement capabilities. So without going too deep into legal arguments, it's my opinion that the ordinance is enforceable, notwithstanding the injunction as to the health department's order.
Thank you, Scott, for that clarification. Are there more questions regarding Dottie K's presentation? Okay, seeing none, I will again thank Dottie K and her staff for that presentation and ask them to stick around for the next couple items just in case there are additional questions where your expertise may be needed. And with that, I will ask Alder Tate to do the Office of the Mayor report. Have you had any requests for separate consideration?
And we'll go ahead and start from there. Item 0808-20, communication sponsored by Mayor Mason requesting to adopt ordinance as listed, 2019 novel coronavirus response extension. Recommendation is to adopt. Move to approve.
So motion to approve this item is a second from Alder Taft. Alder Tate, would you like to speak to your motion?
I mean, very briefly, we have these interventions in place. We are currently, as a country, at the worst place we've been since the beginning. So I think it would be insane to try and remove anything that's, serving to protect our community from this pandemic. So, it's almost a no-brainer, but, we are discussing it.
Thank you very much. Anyone else who'd like to speak to the motion? I'm seeing Alder Perez physically raise his hand, so I'll assume he wants to speak to the motion. Alder Perez.
Yeah. So, looking at the attachment, what the ordinance response extension, is that the correct one where it says ordinance novel coronavirus response extension? Is that the correct one that I downloaded there?
Yes.
Okay. So I have a couple questions on it as we move forward. I get all the whereases, but so in part 1, section C, sunset, it extends it now till June 30th of 2021. It says, unless extended or earlier terminated or modified by the Common Council. Why does it have to be all the way to June if it can be extended or changed by the council instead of making it a shorter amount of time than 7 months out? What's the reason for that? Can someone explain that, please?
Sure, I'll ask President Tate to talk about the thinking around the timing of it.
Sure. So the first time, I think we did this in 90-day chunks, and that's 6 months. So roughly, this is extending it an additional 6 months, as we've already gone, because we saw that clearly things did not change in the last 180 days too significantly to remove these particular restrictions. And while there's a vaccines on the horizon, there's nothing to suggest that, we may not be enduring this for another 6 months. But if we are, we have the option to dial back and step away.
So, okay, I get that part. I just seem to think that another 6 months is excessive, especially with, I get it from the report of Ms. Bowersox that the masks help in the spreading of, or the not spreading of the disease, even though there are many other conflicting reports on that. But I'm kind of curious that the fiscal note also says not applicable, but immediately after that, it talks about the mayor's ability to veto a vote of the council. What's the relationship to that and this particular order? Because it's not in the other documents that we get. Why was this included here? I'm just curious.
So that's standard language. It's the case on everything that the council passes. I either sign it and affirm it or veto it within 5 business days. So there's nothing extraordinary about the language there as it pertains to any other action of council.
No, no,
If
I
I-
understand you have that ability.
If I may.
I just wondered why it was on this
Yeah.
document and not on others.
Alder Tate?
Just to clarify, this was also included in every ordinance that was passed during the budget as well. So I think this is just standard practice going forward. When we amend ordinances, also include the piece of upon passage or action of the council, this is the process that needs to occur. Either the mayor approves it within a certain period of time or has the option of veto, just to be abundantly clear in terms of process, the legislative process. And I think this is just a general practice that's going forward to make sure this is included.
Okay, thank you.
Other questions or members of the council who'd like to speak to the motion? I think we had a good discussion before we talked about this item. I don't see anybody else with a hand raised virtually or physically. I'm just looking at the screen to make sure nobody else wants to speak on the issue. Seeing that there is not, when the clerk will open the roll, when she calls your name, please vote as you wish. Again, this is on item 0808-20, communication from myself requesting to adopt ordinance 18-20-2019, novel coronavirus response extension with the recommendation to extend. The clerk will please call the roll.
Alder West,
Aye.
Alder Toe, Alder Tate,
Aye.
Alder Santiago,
Aye.
Alder Levy,
Aye.
Alder Levy, could you repeat yourself?
Aye.
Alder Peterson,
No.
Alder Horton,
Aye.
Alder Young,
Aye.
Alder Pete,
Aye.
Alder Lamb,
Aye.
Alder Perez,
No.
Alder Taft, Alder Meekma,
Aye.
Alder Lemke.
Aye.
What's
That's
the matter?
12 ayes, 2 noes.
All right, the motion carries. We'll now continue. We'll first do Alder Toe, and then we will continue with the meeting and the mayor's report. Alder Tate, did you have other items for separate consideration?
Yes, I did. First, congratulations to Alder Pete on his first vote in the Common Council. That just happened, so good for him. Next item, 0809-20. Communication from Mayor Mason requesting to extend the City of Racine declaration of emergency for COVID-19 through June 30th, 2021. Move to approve.
So motion to approve. Is there a second? Seconded by Alder Lemke. Alder Tate, would you like to speak to the motion?
I mean, I think right now we're just aligning all of our emergency practices to one, fit with the timeline, and also recognize the reality. We were very optimistic early on in terms of how long this might have taken. I think after 9 months or so of dealing with this, we're getting a much realer perspective on what this is going to take and how much time it's going to take before we're on the other side of this. And this is just a matter of course in reflecting that.
Is there anyone else who'd like to speak to the motion? Seeing no hands, virtually or otherwise, when the clerk calls your name, please vote as you wish.
Alder West,
Aye.
Alder Toe,
Aye.
Alder Tate,
Aye.
Alder Santiago,
Aye.
Alder Levy,
Aye.
Alder Peterson,
Aye.
Alder Horton,
Aye.
Alder Young,
Aye.
Alder Pete,
Aye.
Alder Lamb,
Aye.
Alder Perez,
No.
Alder Taft,
Aye.
Alder Meekma,
Aye.
Alder Lemke. That is 13 ayes and 1 no.
All right, thank you very much. Alder Tate, could you please continue with your report? Are there other items for separate consideration?
I have no other items for separate consideration.
Please proceed with your report.
All right. Where are we at? Item 0811-20, communication sponsored by Alder Young for review and approval of 2021 operating plan for business improvement in District Number 1 downtown. Recommendation is to approve, and the finance director be directed to include these district's special charges on 2020 tax property bills for the inspected parcels. Fiscal note it is estimated that $201,732.06 be raised through the bid assessments and dispersed to the business improvement district number 1 downtown. Item 0812-20, communication sponsored by myself for review and approval of the 2021 operating plan for the business improvement district number 3 uptown. Recommendation is that the proposal be approved and the finance director be directed to include the district's special charge on the 2020 property tax bills. Fiscal note estimated $35,000 will be raised to the bid assessments and dispersed to the business improvement district number 3 uptown. I did have one question regarding that item.
Please proceed with your question.
Yeah, I was just wondering if this was time sensitive or not and had to be approved today, or if it's possible to review at the next common council meeting, because the bid did have some modifications that they need to make. Otherwise, they're happy to submit an amendment to their plan.
Yeah, it's a great question. Under the normal course of action, President Tate, this would have gone through the finance committee before it would have come here. There was an oversight internally that didn't occur, and for us to make sure that the bid is in place for next year's taxes, it needs to be incorporated into the tax bills immediately. I will ask City Administrator Fisher to clarify that further if need be.
Thank you, Mayor. You're absolutely right. Generally, this would have gone to Finance and Personnel as the Douglas Avenue bid did a couple of weeks ago. It was an internal oversight that the two of these did not go. I did not hear from the downtown bid that there was an amendment, and I will say that these have actually already been imported into the tax system to be able to create the tax bills. So we're actually a little bit late on creating the tax bills already. So it would have a significant impact if they didn't get it approved tonight. We would not get the tax bills out on time.
Right. But the bid will have the opportunity to submit an amendment to their operating plan. Is that correct?
As long as it does not change the amount that they choose to levy or assess to the property owners. Yes.
Right. That, in my understanding, that is the intention, that it wouldn't change the assessment values, just the operation plan.
Oh, yes, absolutely.
All right. So yes, we'll proceed as is, and they'll submit an amendment to their plan at a later date.
Great.
Final item on the Office of the Mayor report, item 0769-20, communication sponsored by Mayor Mason, submitting the attached proposed 2021 Common Council calendar as presented. And that concludes the Office of the Mayor report.
Without objection, these items will be placed on the consent agenda. Moving on now to the Finance and Personnel Committee report. Alder Taft, do you have any items for separate consideration?
Request.
Please proceed with your report.
Okay. Item number 766-20, communication from the chair on behalf of the city attorney's office submitting the claim of Amanda Gomez for consideration for disallowance. Recommendation is that the claim be disallowed. Next item is item 807-20, communication sponsored by the chair, requesting permission to apply and accept a grant for mitigation planning, Greater Pershing Drive, Myers Park area. Recommendation is to authorize the Parks Department to apply for and accept the grant. Fiscal note, total project cost of $60,000. Grant amount is $30,000 with a $30,000 soft match. The soft match will be met with budgeted personnel salary and fringe benefits. That
Without
concludes the
objection.
finance.
Oh, sorry.
No, just that concludes the finance and personnel report.
Thank you, Alder Taft. Without objection, these items will be placed on the consent agenda. Moving now on to the wastewater commission report by Alder Taft. Do you have any items for separate consideration?
I have received no such requests.
Please proceed with the report.
Okay, so item 613-20, the submittal of the 2021 sewer services rates. The recommendation is to adopt the 2021 service rates, sewer rates as presented.
Without objection, this will be placed on the consent agenda. Moving on then now to Planning, Heritage, and Design Commission. Alder Young, do you have any items for separate consideration?
Yes, Mr. Mayor, I have two. The first item for separate consideration is item 0716-20, request by John Apple for consideration of the nomination of the property at 3015 and 3021 Washington Avenue as a Racine historic landmark prescribed by section 58, 61, and 62 of the municipal code, historic preservation. For those watching at home, this is the Park Theater, former Capitol Theater, that we're going to be discussing independently.
And so to be clear, the commission's recommendation was to not approve the recommendation to designate the theater as a landmark. Alder Mietma, would you be willing to make a motion to ratify the PhD recommendation?
Move to ratify the recommendation.
Is there a second? Sorry, everybody's muted, so I'm looking for hand waves if somebody wants to second the motion. Seconded by Alder Peterson. Is there any discussion on this item? Alder Young.
Thank you, Mr. Mayor. We had a robust conversation at the Heritage Planning and Design Commission about the historic designation of this theater. We had Building Inspector Ken Plasky come and talk about the structural soundness of the building and the situation that we face, including the court order for the raise of the building. But in terms of the conversation that we're having today, it is about the historic landmark status of the building. And the reason that I am voting against the rejection, as I did in committee, is because of twofold. Number one is the support from my neighborhood. The West Racine Alliance is active in their support for this designation. And number two, criteria that is established by the zoning code for landmark status. So that is why I will be voting against the recommendation.
Alder Levy.
Thank you, Mr. Chair. I received several calls and emails today from constituents urging me to vote no on the committee's recommendation. To be clear, this property is not in my district, but I have constituents who are lifelong residents who have fond memories of this movie theater. They want it to become a landmark instead of seeing it be destroyed. If it's designated as a landmark, it's my understanding this would allow the owner to apply for state and federal restoration grants, which could take away some of the concerns of where funding would come from for restoring it. So because of these concerns, I would like to make a motion to refer this back to committee in order to have more time for the committee to weigh in on this item.
I don't believe that motion is in order. PhD is statutorily required to make recommendations to the council, which they then have to adopt or reject, although I would certainly defer to the city attorney on that point. PhD has some statutory requirements that are a little bit different than the standing committees in terms of our requirement to make a designation by a certain time. Alder Levy, did you want to, do you have other comments you wanted to make while we're just waiting for the city attorney to do that? I also just wanted to ask the city administrator to comment on some of the things that you mentioned in your comments. I think there's some confusion that landmark designation would nullify the raise order that's in effect from the circuit court. Again, and that is a circuit court designation, not a city council designation. And so I just want to ask the city administrator just to talk about the memo that's attached here and the potential liability that the city holds on this item. So I'll ask City Administrator Fisher to comment on that, and then ask Scott to clarify whether or not we need to refer back or proceed tonight.
So I can jump in, Mayor.
Yeah, please.
There are timing requirements under the ordinances. We're talking about a local designation, not a state designation right now. And the commission is required to answer within 45 days of receipt of the application and make a recommendation to common council. So you're right, it's not the same kind of procedure as when something comes through one of the standing committees.
But the more important question that I just want to understand is Alder Levy's motion in order to refer back, or would that run contrary to the ordinance that we have to give a recommendation?
Well, there isn't anything called for in the procedures that would permit the PhD commission to reconsider.
Okay, thank you. Alder Levy, what's your, I mean, I think technically you could ask them to do it. It just may put this item in a procedural limbo, and I don't know if that's what you intend. So, but if you want to make the motion, technically, I believe, based on what the city attorney is saying, that you could, but then there's no requirement that the PhD committee would have to act on it again.
Mm-hmm. Yeah, thank you for that clarification. Given the fact that it would be in limbo and seemingly not having any clear way of moving forward, I will withdraw my motion, and I will be voting no against the committee's recommendation. Thank you to speak.
Thank you, Alder Levy. Alder Land.
I'd like to apologize for not being able to hear everything. So I really don't, I didn't hear Jen's motion. I didn't hear what the motion was. Everything's choppy to me. But I do have some questions. Is Matt Sadowski available?
I believe so. If you could state your question, Alder Land.
I would like to know if this bill.
Please state your question, Alder Land.
I would like to know if this building meets the criteria, if he feels that this building meets the criteria for a historic landmark from section 5861. There's 5 different criteria. Mr. Sadowski, do you believe this building meets these criteria?
I don't know if Matt is there.
Mayor, this is Tara. I do not have him in the attendee list.
Okay. Thank you.
Well, then getting back, is Ken here? Is Ken here?
I don't know if Ken is on the line either.
No, getting back to what was Jen's motion that I didn't hear?
Sure. And Alder Land, can you hear me okay right now?
I can hear you, yes.
Great. So Alder Levy's motion was to refer the item back to the committee. Then Alder or I'm sorry, then City Attorney Letney clarified that that's technically something that that could be done, but the committee would not be required to take the item up again. And given that they voted against the landmark,
Okay.
it probably wouldn't have Alder Levy's desired effect. I don't want to speak for her, but I think that's what she was trying to get at. And so
Okay.
wanted
I
to clarify
understand.
that.
I understand. I too received a lot of calls and emails about this, and I realize that there is a group that has formed that wants to try to save this building. I'm wondering if a deferral would be an appropriate motion.
Yeah, I mean,
To
why
defer
don't
it.
you,
Days.
yeah, I mean, just you could defer that. That would be in order. I would just remind people so that people understand, and I'm going to ask the city administrator to clarify this in the memo. Landmark status does not prevent the raise order from moving forward. So whether we declare a landmark status or do not, there is a raise order in effect from the Racine County Circuit Court that has been in place for more than a year. The city litigated it for over a year, and for public safety reasons, the raise order is in effect. So I'm going to ask the city administrator just to lay out.
I don't know, is it not?
No. So to be clear, we are not voting on whether or not there is a raise order. There is a raise order.
Right.
Right. So if you wanted to defer consideration of the landmark status, we could, but it would not slow down the raise process.
I understand that, but I would like to defer.
Okay.
I
Your
make
motion,
defer.
your motion to defer is in order. Is there a second on that motion? There's a second from Alder Levy, or are you waving your hand to second it? Yes? Yes. Okay, so there's a second from Alder Levy. Alder Land, would you like to speak to your motion?
I just think I'd like to give this grassroots movement a chance to look at things to see if there's anything they can come up with. And I think if it doesn't hurt to, when is the raise order for? How?
So I'm going to ask the city administrator to maybe fill in some of the gaps. The raise order is more than a year old. We litigated it for more than a year. The landmarks, or the PhD commission, actually deferred this item for several weeks to try to give the grassroots group more time to come up with a viable plan that might stabilize the building and put it in a position to be able to do that. It's clear from what we've heard from the building inspector that the raise order is in the interest of public safety. So I'm going to hand it over to the city administrator at that point to clarify some of this, and then we can continue discussion on Alder Land's motion to defer. Administrator Fisher? Kathleen, are you there?
I am here. Thank you, Mayor. I just had to wait to be unmuted. Thank you for the time tonight, Alders. I did attach an ABM to the item, and I just want to clarify a couple of things. Most certainly what this group is attempting to do is quite admirable, and if anyone knows me, they know I love an old building. I honestly do. I just want to clarify a couple of things. This group does not own the building. The owner of the building is Mr. John Apple. And there is right now $180,000 worth of back taxes that have not been paid since 2008 by Mr. John Apple. So while, again, what this group is doing is admirable, even the ability for them to in any way acquire the property to do what they want to do is an extremely long process, if it could even happen at all. And I would caution the Common Council as to whether if any sort of process happened to transfer this property, whether that be through foreclosure or in REM, what type of long-term effect that may have on other property owners of this sort within the city of Racine. Again, this group, it's very, very admirable what they're doing. This property has been there and owned by this owner, and to be honest, neglected by this owner since 2008. And at any time they could have come forward since 2008. So I wanted to make that clear that while what this group is doing is admirable, they have no interest in this property. They do not own it. They have no rights to it. They don't have an offer to purchase on it. So I just want to be clear on that.
Alder Land, you still have the floor.
I'd still like to defer it if it's not going to hurt anything. I still, we're talking about one particular item here. The raising is a different item. I'd still like to defer it.
Okay. I just do want to clarify, like, we're not voting on the raise order tonight. That remains in effect. So I just want to make sure that people understand that the raise order could proceed in the intervening time. Alder Miedema, you have your hand up.
Just to clarify, at this time, I would be speaking on the proposal to defer.
Technically, yes.
Okay, thank you. Yeah, and I would speak against deferral of this. I think, as the city administrator said, I think it's really great that this group is stepping forward now, trying to do something for a building that has a lot of history. I think there's always, people reflect on their memories of something and passionately want to defend something because of experiences they've had there. But things like this happen in communities all over the place, and buildings get torn down that have historical value. It happens all the time. I think it's really great that, people want to do the right thing, but this building has been sitting there. It has been neglected for years and years and years. And in the final hour, when it's actually going to be torn down, then people are coming forward trying to do something to do this. But it's had an owner who's had no interest in bringing it back to its former glory, of honoring the history that building has brought to this community, of giving it the life that this group now wants to try and give back to it. But I have concerns that if we draw this out and with a deferral, that it's only going to continue to make this into a thing that it doesn't need to necessarily be. As passionate as people may be, I have concerns that they're going to get drug into something that they find out they don't necessarily want to be involved in. There's an owner of that building that it has not shown to be with carrying the best interest of that building forward, and the fact that they owe back taxes and may have found a loophole to not necessarily have to pay those back taxes and to be using this group to gain that advantage seems concerning to me. And I really just think a deferral at this point doesn't make a whole lot of sense. I think the attempt to save this, unfortunately, doesn't make a whole lot of sense. I wish it did. I wish we'd been doing this 10 years ago and working to save this building at that point. But, and with the fact that it sounds as if nothing that we do is going to stay the raise order, it's going to happen, even if it is designated as a historic landmark. That building is more than likely going to come down either way. It's just going to give us the opportunity to honor it for a very short period of time. And I guess if that's what people want, then fine. But I don't find myself in a position to be able to support this in any way at this time. So I will be voting against the deferral. Thank you.
Thank you, Alder Miedema. Alder Coe.
That we could give them, to have them come back to us and say, you have to have a definitive answer in this time frame. We know it's going to be torn down. I know how bad the building is. I know the owner and everything. But is there a time frame of some sort that they'd have to answer us by, and then that'd be the end of it?
Yeah, that's a great question, Alderco. I think when the Planning, Heritage, and Design Commission was weighing this, and part of the reason they deferred it themselves was to give this local group time to come up with answers that we hoped would be satisfactory. I mean, I think everybody would, want to root for the local group to be successful here. What that was weighed against was the chief building inspector and his concern about the raise order, which was not put in place lightly. He described it as one of the most concerning buildings he's been in as an inspector, and raised concerns about what the liability for the city would be and what the impact of public health might be if the building collapsed over the winter. And so I think that's what makes the timing on this more urgent than, why don't we just study it for a few more months and see if we can come up with a solution. It's really the raise order that is not in place just because there's back taxes or who the landlord is or any of it. It really speaks to the structural integrity or the lack thereof that puts the raise order in place.
Yeah, I realize that, but I don't believe that's probably going to be torn down this year. And I'm wondering if we gave them 90 days to come back to us with some sort of concrete plan. Otherwise, we just move forward. And it's not going to stop us from tearing it down regardless. I know John Apple had a building downtown we had to take, 410 Main Street. I know how bad that was. We had to take it or that would be gone. But I'd like, a lot of people have called and asked. And I guess, if they could come up with something concrete, 90 days, I'd be willing to go that far, but I wouldn't be willing to go past that date. Because I believe this building probably wouldn't be torn down till spring anyway.
I don't think that's a reliable assumption, Alderco. I just think that you should know from the city inspector's standpoint, it's not, the raise order is in place. I think for public safety reasons, he intends to move on the raise order.
How much time frame does Mr. Apple have to get his stuff out of there when this time comes? Does he get any certain amount of time?
I think I would defer your question to the city attorney. I think that goes to what the circuit order raise order says in terms of what that process is statutorily.
Well, the raise order is in effect, but for this current request for historic designation, it could take place at any moment. I know that the building inspector has been dealing with these issues, so he would certainly, I'm sure, allow an opportunity to get things out. But his order at this moment, in part, says nobody's allowed to enter the building because it's so dangerous. So there would have to be some kind of an accommodation. But that raise order has been around a long time, and frankly, I know he's concerned about the safety of the building. So,
no, I totally understand that, but like I said, I don't think not. I just think if these people aren't going to be able to come up with this. I know it's a great thought. I know how great the building was growing up here, but if there's one last shot at it, I'd be willing to give it a go. If we could give them a time frame of like 90 days to come back with a concrete answer and money.
Okay. Other people wishing to speak on the item, Alder Tate. Oh, sorry, your hand is not up anymore. Alder Perez, sorry.
So I'm against the deferral. I'd like to just point out that what they're asking here is for a local landmark designation. It doesn't change the RAS order. When I moved here 15 years ago, that was one of the first places they showed me when they showed me around and showed me and told me about the historicity of it. I'm just thinking that if we go ahead and just designated that, it becomes part of the official history of Racine, as opposed to whether it gets RAS later, that's besides the point. When our history books are written in the future about what happens now, then we have a designated theater where people played at and so forth, and just adds to the culture of our community. So a designation itself, I understand, doesn't change the RAS, but does change history as in the way that it's written. Now I would say that we don't defer it now. We vote on it, and we vote on it as a local landmark, simply for the fact that it gets designated as a local landmark and becomes part of our history. That's all. Thank you.
Alder Lemke.
Thank you, Mr. Chair. So I would just say I'm against the motion to defer. From what I read, it seems like, you know, in order to restore the building, people would have to come up with over $1 million. And this isn't something that's new. It's been going on for a long time, and sort of out in the public and talked about for a long time about this particular building. And I mean, would I love to see a historic theater saved? Absolutely. But I mean, if we say to people, you have 90 days to come up with $1 million, that doesn't change the raise order. So then you're telling people you have to come up with the money for something that's legally going to get raised. It doesn't make sense, because then people will think that, you know, there won't be any public trust. It'll be like, oh, the city agreed that they were going to wait 90 days and we were going to raise $1 million, which is not the case. You could tell them, we are going to wait 90 days and you can try to come up with over $1 million, but then to have the city raise it, people will think that we did something that's, you know, shady or what have you, when the real case was there was never anything on the table that would overturn a legal raise order. So I don't get what that is doing. I mean, if we want to designate it or not for historic purposes, like Alder Perez said, I don't have strong feelings on that. But I mean, to give people, I think there's a difference between saying, you know, whatever we want to do with this as a historic landmark, you know, to put it in the history books or not is one thing, but to say we're going to wait when that's not at all the intention is going to erode public trust in local government, in my opinion. That's all.
Thank you, Alder Lemke. Alder Levy, your hand is up.
Sorry.
Oh, okay. Any other, Alder Coe, your hand is up. Did you want to speak to it again? Nope. Okay. Just scanning the screen. I just want to make sure I didn't miss anybody else who'd like to speak. So the motion before us is to defer this item. When the clerk calls the roll, please vote how you would wish on the motion to defer this item. Hoping the clerk is muted. I hope she knows that.
I did it to myself. Alder.
All right.
Alder West.
No.
Thank you. Alder Coe. Alder Tate.
No.
Santiago.
No.
Alder Levy.
Aye.
Alder Peterson.
No.
Alder Horton.
No.
Alder Young.
No.
Alder Pete.
No.
Alder Land.
Aye.
Alder Perez. Alder Taft.
No.
Alder Meekma.
No.
Alder Lemke.
No.
That is 3 noes. 11 noes and 3 ayes.
Motion failed. The motion to defer fails. We are now back at the main motion on the landmark status itself. Alder Tate.
Thank you. These are hard conversations to have, right? I toured, actually, several of us toured the Majestic Theater in my district, uptown, just a few years ago. And walking through there, we're like, fingers crossed, this place looks good enough to restore. We walked out saying, gosh, I hope there's other places in Racine that we can catch before they're too far gone. Unfortunately, we were able to do that. You know, Horlick Project is an example, Gold Medal is an example of places that weren't too far gone. Actually, we're still in operation to some degree, which is why they weren't too far gone. Unfortunately for the park and for the group that is looking to save it, the first barrier in the way is the owner. Like, there's no getting around it. Somebody else owns this property and has done nothing in the time that they've owned it to protect it, to usher it into a new era, to restore it. And the only thing that's happened in that time is that it's degraded and degraded and degraded to the point where it no longer is recognizable to what it could have been. And also there's been structural changes within the building that bar it from being recognized as historical. There are changes in the building that say this isn't even what it was originally. Whether there's a splitting of a room somewhere or removal of certain fixtures. The hardest part about this is I feel for the group, the West Racine Alliance, that wants to save this building. The problem is they're 10 years too late. This building has been dead for a long time. And it's unfortunate because the owner who currently has it did nothing, contributed to killing it. And it's not only this building, but dozens, or at least several throughout the city of Racine that are declining, that are used not for their original purpose, for storage, and thoroughly back on taxes. The first step that these folks would have to do is raise $180,000 just to get the property out of the rears for the county. We talk about the, people suggest that we should foreclose upon it. The county doesn't want to foreclose on this property because it's under a raise order. Why would they take something that is structurally dangerous into their possession? Why would we take something from them that is structurally dangerous into our possession? And if the individual, if this owner is looking to sell to these folks, that's one thing to even explore. I've seen nothing that indicates that John Apple wants to sell to the West Racine Alliance and get this property out of his hands and into theirs. I don't see that happening anywhere. I don't see anybody proposing that. Just to slap a landmark designation on there is one thing, and I agree with Alder Perez. It might, put it into the record as a historical site. But the number of things that have to occur to get from dead to alive again are insurmountable as it relates to this place is already designated to go down. It's like trying to wake somebody up that's already been knocked out and the match is over and say, keep fighting. This match has been over for a long time. It's a shame that these buildings in the city of Racine have been neglected by these individuals who refuse to do what's right by them and then wait until somebody else has to do the right thing and then give this false sense of hope to folks who never wanted to happen because they failed to do their due diligence in protecting a landmark in the city. That's shameful. And now we have the unsavory responsibility of saying, you've done wrong for so long by this building that it can no longer stand. And now it's not even up to us. Actually, a court has decided already that this building can no longer stand. And we've got to try and help a grieving community understand why something they love died when it didn't need to. That's kind of what we have to do all the time as the council right now, is help people understand why deaths are happening, whether they're buildings or diseases, when they shouldn't. And this is an example of a building that should not have died, did not have to die, did not have to get to the way it did, but somebody allowed it to happen. And now there's nothing we can do to restore that. And the process to even getting to a place where you might even think about restoring it is so far out that it's going to be buried by then. And I think to Alder Lemke's point, if we're going to be honest with the community, we can't put false hope out there. This building is designated to go down any day now. And the winter could do it without the construction workers, quite frankly. Freeze and thaw cycles are what kill these sorts of buildings. And this one's been through one too many to maybe even survive this winter. And it's shameful. but it's not on us to say we can stop this because it's too far gone. I really feel for the community. And I know that if it were in my district, I probably would be supporting and fighting for them just as much. Maybe not, because I've talked to constituents of my own who say, please save this building. And I've explained to them what the circumstances are. And when I've explained to them clearly, the response is like, dang, why did it have to get to this point? And the question is, all of us asking, how and why did it have to get to this point? It didn't, but now we're here. I don't necessarily have strong feelings about the historic designation. The fact remains that the raise order will remain in effect no matter whether we designate it as historic or not, or as a landmark or not. But I do think we need to be abundantly clear as the city council, as the representative body for our citizens. What they want to see happen with this building is really not an option because of the neglect of the current owner, because of the failure of the current owner to be a good steward of a historic property in our city. And it's our job to be forward and straight up with people and let them know why we're here and what has to happen next. You know, I've seen some suggestions that, you know, we force somebody to sell a bunch of old barber chairs in the building. We don't have the right to do that, to make them sell that. And nobody has the authority to necessarily do that either, except for the person who owns it. So if there were a path, the first path is John Apple. And I don't want to say somebody's name, but that's the owner. The first barrier has nothing to do with landmarks, has nothing to do with the city at this point. Your first barrier to doing anything with this property is a man named John Apple. And if he doesn't cooperate with this group or show any interest in moving forward other than putting a request in for a historic landmark designation, that should tell you all you need to know about what the potential is for this building and its restoration, which is well outside of the realm of possibility right now. So, you know, I certainly feel for the alders who represent this area and kind of have to weigh, you know, the reality of the situation versus what your constituents want, because that's the hardest thing to do as an alder. But I hope for the rest of the council that maybe doesn't have to carry that same weight as the alders for this area, do the right thing, and, you know, be forward with our constituencies and kind of acknowledge the reality of somebody failed this building. Somebody failed this historic landmark. Somebody failed this piece of history that so many people have so many memories in. And the moment to respond to that has passed. And it's a sad reality. But we have to do our part, perhaps designate it as historic and put it into the record. But there's nothing we can do to stop. There's nothing that we should do or can do to stop the raise order, because that a judge made that determination. And the building inspector, the professional who determines the safety of buildings for citizens, has determined that it's uninhabitable. So, you know, if somebody can convince me, you know, Alder Perez makes a more compelling argument that we should move forward with the designation just for, you know, for the record, you know, let's have that conversation. But I do want to make sure we're distinguishing the conversation between the landmark designation and the preservation or salvageability of this building, which are not the same thing. And one of these is real, the other is not. And that is a terrible and hard thing to say, but it's our job as alders to kind of say the hard truths and then go from there. Thank you.
Alder Land. If Tara could unmute Alder Land.
Yes, what we are discussing here is the building, not the raising of it. And I think that Perez was correct in saying that it tells a story, and whether making a landmark story part of our history, whether it's raised or not. So I'm going to support making it a mark.
Thank you, Alder Land. Are there others who would like to speak to the motion? I don't see any other hands up. If people want to wave, if you want to speak one more time. Okay, if not, before we vote, I want to explain how the vote will go because it's a little bit confusing. So the recommendation from the commission was to not recommend landmark status. So if you agree with not giving the building landmark status, you would vote yes. If you are against denying them landmark status, you would vote no. So it's a bit counterintuitive. We are not voting, yes is not to vote to give them landmark status. Yes is to agree with the commission's recommendation not to give them landmark status. So I just want to make sure everybody's clear on the motion that's before us. President Tate, did you have another point you wanted to make or clarification you wanted to make? You're still muted, sorry.
Question about, actually, is there anybody on the call that can speak to the actual historic designation and what that means going forward? Because I know Alder Perez alluded to, like, you know, could just put it in the record, but I would like somebody to be able to speak to, like, what does it mean to actually designate this as that? What effect does that have? Because it hasn't necessarily been made clear in the conversation thus far.
Yeah, I'll ask the city attorney to perhaps comment on how the raise order and a landmark designation might interact with each other and private rights of action and
nothing with the raise order. I'm just curious, like, what does it mean to be historically designated, and what does that ultimately do physically? The raise order is a different issue, and I think we understand that exists outside of the designation.
Okay.
So, Mr. Mayor and Alder Tate, the designation as a landmark or historic property is a declaration by the city, the Common Council, that this building reflects, and I'm honestly quoting from the ordinance, the cultural, archaeological, political, economic, social, or religious history. It's identified with periods of history, embodies distinguishing characteristics of architecture, craftsmanship, or works. In its historical nature, provides the citizenry with educational or aesthetic enrichment. So it's a declaration by the Common Council that this property, in fact, represents some or all of those things. It doesn't require that the building exist forever by any means. It's just designating this as that kind of property.
And just to clarify, Attorney Letney, does this designation at all impact the timing of a raise order?
The only thing that affects the timing of the execution of the raise order, in other words, the raising of the building, is while this process is going on, as the ordinance currently exists, a permit to actually raise the building cannot issue. So the raising can't occur while this is under consideration. But raising of a landmark site is anticipated by the ordinances. So as has been discussed, even if a declaration of landmark is approved by the Common Council, the raise can occur. And in fact, the designation by the council would then allow the raise to occur at the time the chief building inspector thinks is appropriate.
But just to clarify then, based on the action, so if we took no action today, the raise order could proceed. If we gave it landmark designation, the raise order could proceed. But while we're considering it, as we're going into the winter months and heavy snows may fall, during that period, the raise order cannot occur.
While the council is considering it, yes, the raise may not occur.
So to be clear, once a decision is made, whether we designate or not designate historic, that effectively opens the window for when the raise can occur.
That's correct.
Okay. So by not acting upon this is really the only thing that prevents a raise. Is that fair?
Yes.
Okay. Thank you.
Important clarification. Thank you, Alder Tate. Alder Land, you have your hand up. Is this from before, or did you have another comment? Oh, sorry. We got to unmute you real quick, Mary. Hang on just a second. Okay, go right ahead.
had problems hearing. It was fading out what Attorney Letney was saying, but he said something about while it's being considered, it prevents the raise, but isn't this the consideration today? So once it's done being considered today, wouldn't the raise order then be in effect? That's my question.
The raise order is in effect, but the raise cannot actually occur while this is being considered. Once the Common Council decides, whichever way it goes, then the chief building inspector could issue the raise permit and the raising could occur.
So there's no other, it would be the city council then that would be declaring this a mark? It doesn't have to go anywhere else?
Right. This is a city designation. It's not a state or national designation. So this would be it.
So then to clarify, it's just on hold now, and if the decision is made tonight, the raise order can go on tomorrow, correct?
Right. Yes.
An important clarification, Alderland. Thank you very much. Are there others who want to speak to this question? I'm seeing no hands raised. Oh, Alder Tate, the second.
Take a position prior, but with the status of the conversation, I will be voting against the recommendation and in support of the historic designation. Thank you.
So, are there others who would like to speak to the item? Seeing none, I just want to reiterate, so we are considering item 0716-20, a request by John Apple for consideration of the nomination of the property at 3015, 3021 Washington Avenue as a Racine local landmark as prescribed by section 58, 61, and 62 of the Municipal Code, Historic Preservation. Again, the Planning Commission's recommendation was to reject this designation. So if you are voting yes, you are agreeing with not giving this building landmark status. If you vote no, you are voting in favor of, well, I'm just trying to figure out what that's actually.
Yeah, point of order.
Yeah, let me just ask the city attorney to clarify. So if the motion plays out in such a way after the vote that the planning, heritage, and design recommendation has been rejected, would then a subsequent motion to do something different have to occur, or is that something that would have to be separately noticed at a future meeting?
To answer your second part of your question, no, it wouldn't have to be separately noticed.
Okay.
So as you said, an aye or yes vote to the motion would approve the recommendation of planning, heritage, and design. And yes, that would result in the denial of the landmark status. A no vote would simply be a vote opposing the recommendation of the Planning, Heritage, and Design Commission. And then, assuming a no vote were to be in the majority, then if desired, there could be a motion then to grant the landmark status that the council could vote.
Thank you. I just wanted to clarify that procedurally. I want to make sure everybody understands that before we vote. So I think we've made clear exactly where we are on the motion before us. When the clerk opens the roll, please vote as you wish.
Alder West,
Aye.
Alder Poe,
No.
Alder
No.
Alder Santiago, Alder Levy,
No.
Peterson,
Yes.
I'm sorry, Alder Peterson, I couldn't hear you.
Yes.
That was a no, you said?
Alderman Peterson is a yes.
Thank you. My apologies. Alder Horton?
No.
Alder Young?
Nay? No?
Alder Pete?
No.
Alder Lamb?
No.
Alder Perez?
It's nothing to do with saving it. It's just about giving it a landmark status. It's still getting torn down. It's stupid.
Alder Perez?
So it can be put in history books. You can still put it in the freaking history book. The landmark.
Alder Perez?
No.
No. Thank you. Alder Taft? Alder Mikma? Alder Lemke?
Yes.
That is 3 ayes and 11 noes.
Alder Young.
Mr. Mayor, would it be in order right now to then make a motion to approve this item as a landmark?
I believe that motion would be in order.
I would move to approve item 0716-20.
No, it would actually need to be a separate motion. You wouldn't be referring, because item 0716-20 was the recommendation to deny the status. So you'd need to make a separate motion to designate landmark status under sections 58, 61, and 62 of the Racine Municipal Code.
I would move to designate landmark status to the property of 3015 to 3021 Washington Avenue as a landmark under section 58-61 and 62 of the municipal landmark code.
Second.
There's a second from Alder Coe. Any discussion on the item? I see no discussion on the item. The clerk will open the roll. When she does, please vote as you wish.
Alder West?
No.
Coe?
Aye.
Alder Tate?
Aye.
Alder Santiago?
Aye.
Aye.
Alder Peterson?
No.
Alder Horton?
Aye.
Alder Young?
Aye.
Alder Pete?
Aye.
Alder Lamb?
Aye.
Alder Perez?
Aye.
Alder Taft?
Aye.
Alder Mikma?
Sure.
Alder Lemke?
No.
That is going to be 7 ayes and 3 noes.
Right, motion carries.
Hey, Scott, Jeff Oliver. Yeah. Hey, I just want to circus, huh? Well.
You're not muted.
Scott, you are not muted right now. Okay, I think we have everybody muted. We can move on to the next item. I'll just ask Alder Tate to make the distinction that he made earlier on this item between its designation and the raise order.
Oh, thank you. Yeah, the raise order, our designation of it as a historical landmark does nothing to prevent the raise. In fact, it initiates the process for the raise to resume, because we are no longer debating whether it's a historical property or not. So to be clear, we have designated this as a historical entity. Anyone who has interest in preventing or interrupting the raise process there's a long road with a short amount of time to try and track down. So, do what you can, but this building is not in a condition to remain standing as it currently is. But yes, just to be clear, raising is very different and does nothing and has no impact on and is not influenced by the designation of historic landmark. Hopefully that's a clear enough distinction between those two.
Thank you very much, Alder Tate. I would then ask Alder Young to read the next item. And I believe this is for separate consideration.
Thank you, Mr. Mayor. Yes, it is. Item 0697-20, communication sponsored by Mayor Mason requesting adoption of ordinance 0009-20, raising of properties as attached. The recommendation of the Planning, Heritage, and Design Commission is that this ordinance be adopted as attached. I would move to approve.
Is there a second on that motion? I see a second from Alder Lemke. Thank you, Alder Lemke. So I'm just going to ask the city attorney to explain the ordinance for a few moments. We discovered in this process that we actually have an inconsistency in our ordinances. This is an ordinance that seeks to clarify that inconsistency. Attorney Letney, can you briefly describe the change proposed in the ordinance here today?
Yeah, thank you, Mr. Mayor. So in the last discussion, when I said the raise was put on hold pending the council's decision tonight, this ordinance in some ways would change that. So the way it exists right now, while there is a request for historical or landmark designation, a raise cannot occur at all. Even in a situation where the chief building inspector deems the building so unsafe that it should come down immediately. If somebody seeks landmark designation as it exists right now, that can't occur. So what this ordinance would do is say that not that raises can't occur while the process is happening, but that the owner or representative of the owner cannot seek to have a building raised while the designation is occurring. So if we look at this a different way than the current property, let's suppose there was an intent to designate a certain area as landmark or several buildings or something. Somebody buys one of those and decides they want to tear it down while that process is occurring. The ordinance as changed would not allow the owner or the new owner of the property to do that. But the chief building inspector would, under the changed ordinance, be allowed to tear or to order a building raised when the chief building inspector deems it's appropriate, even if there is this process going on as you saw tonight. So that's really the significant change, is it gives the chief building inspector the flexibility to issue raise orders for buildings that he considers unsafe, and an owner simply applying for landmark status couldn't prevent that from happening.
Discussion on the item. Alder Young.
Thank you, Mr. Mayor. So a couple of reasons I support the update to our ordinances. Number one is good governance. We shouldn't have one ordinance that states this is the process, another ordinance that states this is another, creating confusion. And as Alder Lemke eloquently stated earlier, sowing seeds of distrust within local government. That's number one. Number two is, I think if we clarify the expectations about what it means to take care of your buildings and what it means to be held accountable if you don't, this is taking away one tool that folks who don't take care of their properties could potentially use to delay a process, and in turn result in them realizing they don't have the tools necessary to not take care of their properties, and hopefully they decide to do a better job with what they own. So I think in terms of good governance and in terms of disincentivizing poor property ownership, we're making the correct decision by adopting this ordinance.
Thank you, Alder Young. Alder Perez.
The question that I have, because there's a state law reference, does this clean up our language to be consistent with state law, or are we actually doing something different in our own ordinance, but just kind of looking at what the state law says?
I'll refer your question to the city attorney.
There we go. Thank you. Thanks, Alder Perez. The state law reference is actually the statute 66.40413, which is the statute about raising buildings. So the reference in the ordinance to the state law is just to assure that the state process for actually ordering a building to be raised is always followed, irrespective of this landmark designation.
But is that consistent then with the changes that we're putting in place, or is that different than the changes we're putting in place?
The changes in place that are being proposed really have nothing to do with the statute. The statute says that however a building gets to a raise order, there's a statutory process it has to follow. This is just changing the local permissions for that kind of thing.
So does this in effect say that if someone wants to buy a building the building's about to be raised, someone can't just say, hey, I want this to be designated as a landmark and then put that on hold?
I think that's a good way of saying it.
Okay. Thank you.
Thank you, Alder Perez. Any other questions or discussion? Seeing none, the clerk will open the roll on item, I apologize, on the wrong page. On item the 0697-20, communication sponsored by the mayor requesting adoption of ordinance 0009-20, raising of properties as attached. When the clerk calls your name, please vote as you wish.
Alder West.
Aye.
Alder Coe. Alder Tate.
Yes.
Diago.
Aye.
Alder Levy.
Aye.
Yes.
Alder Horton.
All right.
Alder Young. Alder Pete.
Aye.
Alder Land.
Aye.
Alder Perez.
Aye.
Alder Taft.
Aye.
Alder Mikma.
Aye.
Alder Muncy.
Aye.
That is 14 ayes, 0 noes.
Very much. Alder Young, do you have other items for separate consideration?
I do not, Mr. Mayor.
Proceed with your report.
All right, good job, team. All right, item 0784-20, request from Tim Callahan of Smith Welding Fabrication for consideration of a conditional use permit to operate a contract shop and office for welding and fabrication of metals at 854 Washington Avenue. Recommendation of the Planning, Heritage and Design Commission is to approve, subject to conditions A through J. Item 0785-20, request from Jeff Brittleman of Partners in Design Architects, agent for Gateway Technical College for consideration of a major amendment to a conditional use permit and request for approval of exterior changes within the downtown design review area to allow for two additions at 1001 Main Street. Recommendation of the Planning, Heritage and Design Commission is to approve, subject to conditions A through G. Item 0786-20, request from Antoine Lowy of Spectrum Electronics LLC for consideration of a conditional use permit to operate a garage for the sale of storage and repair of motor vehicles, scooters, and mopeds at 1400 Dr. Martin Luther King Drive. Recommendation of the PhD committee is to approve, subject to conditions A through I. Item 0787-20, request by Heartland Housing Incorporated for consideration of a rezoning of the property at 1760 State Street from I-1 Restricted Industrial District to I-1 Restricted Industrial District with a FD Flex Development Overlay. Recommendation of the Planning, Heritage, and Design Commission is to be approved. Item 0788-20, consideration of the use supplement of a companion as an FD Flex Development Overlay District rezoning for the property of 1760 State Street. Recommendation of the PhD committee is to be adopted. That is the end of my report, Mr. Mayor.
Without objection, these items will be placed on the consent agenda. The next the next committee report is actually does not have Alder Young on it, but Alder Tate is on it. So I will ask Alder Tate if he would please excuse the error on the agenda and give the report. First, I will ask if there are any other. Is this an item for separate consideration?
It is not.
Please proceed with the report.
All right. Item 0731-20, communication sponsored by Mayor Mason requesting the city accept the offer of Christopher S. Zemechnik to purchase 1100 Park Avenue. Recommendation is that the offer be accepted. Further resolved that the mayor and city clerk and director of city development are authorized to execute any documents necessary to complete the sale. Fiscal note: the city will receive $155,000 in the CDBG program income minus commission and closing costs. And that concludes the Community Development Block Grant Advisory Board report.
Without objection, this item will be placed on the consent agenda. And then we will now move on to that consent agenda. Alder Tate, would you like to make a motion?
Move to approve.
Motion to approve the consent agenda. Is there a second? Seconded from Alder Coe. Any discussion on the consent agenda? Seeing none, if the clerk could unmute everyone. All those in favor of the consent agenda, please say aye.
Aye.
Aye. Opposed? Consent agenda passes. Thank you very much, everyone. We now move on to announcements. Reminder to everyone, announcements are not to include city business or political affairs or electoral items. Discussions of matters related to government business is prohibited, but are rather intended for recognition of city residents and employees, memorials, and non-political community events. Are there any announcements as we move into December? Alder Mi'kmaq.
Thank you, Mayor. I just want to give a quick shout out to Alderman West for upping his virtual background game.
Thank you very much for that announcement. Alder Levy.
I want to wish my husband happy birthday today. He has an hour and 10 minutes left of his birthday. So wishes to him. And I want to wish everyone just a safe week ahead as we continue dealing with all of these challenges we're facing.
Indeed. Indeed. Any other announcements that alders would like to make? As we close, I do want to adjourn in honor of those public health professionals and first responders that are really going into what has been a long year and an even tougher winter. I know this has been an extraordinary time for our community, but really want to thank them for their professionalism and their commitment to public service. And so with that, I will turn to Marcus West, to Alder West, and ask him to make a motion to adjourn. Oh, I'm sorry, wait, before we do that, Alder Taft has an announcement she would like to make. I apologize, Alder Taft.
Yes, I just wanted to wish Alder Tate a happy birthday tomorrow. So I think that's an important thing to recognize this evening.
Yay, happy birthday. All right, just in the nick of time. Any other announcements? I just want to make sure I'm not missing the opportunity to do that. Seeing no other announcements, Alder West, a motion to adjourn would be in order.
Move to adjourn.
The motion to adjourn, is there a second? seconded by Alder Young. All those in favor of adjournment, please say aye.
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 Opposed? The ayes have it. We are adjourned. Thank you, everyone.